So we know that traumatic brain injury is associated with an increased risk of developing Alzheimer's disease, but we don't really understand what are the pathophysiological mechanisms that lead to that, particularly when you have a history of repeated concussions, for example, and many times those happen earlier in life or in adult life, but Alzheimer's disease does not manifest until years or decades later. So what is the lingering mechanism that is later increasing that risk of Alzheimer's? And we use the retina as a model to try to better understand this question. So let me tell you why we're looking at the retina, because it's maybe a question that many people may be interested in. So first of all, the retina is an extension of the brain. So it's a good model for the central nervous system in general, and pathophysiological findings that we find in the retina could be extrapolated to the rest of the central nervous system. But the advantage of using the retina in particular is that it's an easily accessible part of the central nervous system that can be imaged, and there's tools available for imaging and for functional analysis in a non-invasive way that have much higher resolution than what we can do for brain nowadays, especially in live people or animals if you're doing research, right? But apart from that, not many people know that Alzheimer's disease also leads to visual dysfunction. And that can pose an additional burden to a population that's already vulnerable and can increase the risk of falls and can increase confusion in Alzheimer's disease patients. So we want to understand how much of that outcome is due to primary pathology in the retina caused by Alzheimer's disease. And finally, also there's different outcome measures that you can see in the retina that are being studied as potential biomarkers for Alzheimer's disease that might allow us to track disease progression or perhaps detect the onset of the pathology earlier on. So and that's a host of reasons why we're looking particularly at the retina. But in this case, we're using the retina as a model of the central nervous system to look at the correlation between mild repeated traumatic brain injury and Alzheimer's disease. And we used a rat model for this work. This is a rat model that really recapitulates a whole cohort of Alzheimer's disease pathophysiology as they appear in humans. And we expose this model to a two-time controlled cortical impact paradigm, which basically is something that mimics mild concussions. And so we're asking, what happens if these rats have mild concussions earlier in their life? And this would be equivalent to an adult or a young adult in humans. And we're looking several months later in what would be equivalent to an older adult in humans. And what we found in the retina is that these repeated concussions exacerbate Alzheimer's disease pathology. We see Muller-Glia activation, which is a sign of neuroinflammation, both in Alzheimer's disease alone, in TBI alone, and in the combination. But having the combination of both leads to more mature plaque formation, amyloid plaques, and an increase in cell death. So it seems to be exacerbating the pathology. And we take that we extrapolate that to hypothesize that what TBI is doing here is accelerating the onset and exacerbating the pathology, particularly in individuals that are predisposed to Alzheimer's disease. I must also add that this work is part of an exciting and fruitful collaboration between my lab and the Department of Ophthalmology and the University of Colorado Alzheimer's and Cognition Center.